All right, everybody, welcome back to Burst TV. Today I've got Spring Hatfield. She is a fellow nerdy dental hygienist. We've both been in the field for about 20 years, and I know this because we just shot this a little while ago as like a practice, and the audio was, not great. So this is going to be even better for the people watching this. So welcome, Spring. Thank you so much for being on Burst TV.
Well, thank you for having me. I'm so excited.
So we've never met before, but I've known your name for a long time because you are also a contributing writer for today's RDH, which is super cool. And I know a lot of people out there are like, oh, how did you get into that? So can you tell me how you got this writing gig?
Well, I just decided one day that I was reading articles and I said, you know what? I could do this. I don't know why I don't try to do this and share information with people. And I wrote up an article, sent it in, and they were like, hey, can you write for us? And I said, yeah, I would love to. It's such a creative outlet and it's so fun and I love doing it. So it worked out perfectly.
See, everybody, it is that easy. Like
It
you don't
is,
have,
it really is.
If you're interested in something, and because people are like, how did you get the Burst TV gig? I'm like, I just said I can do this. Somebody asked me, can you do this? I'm like, yeah.
I think that's the big thing is to say yes, because you get offers, you get opportunities, they're put out there, and people are too afraid to just try, and you don't know what you can do if you don't try. So right. You got to at least try.
And it's okay. You can figure out as you go along, and you will have people around you to help. Like you're not on an island by yourself. And that's the awesome thing about the internet is we can do stuff like this from our homes, which is so cool.
Exactly.
So the whole internet technology thing kind of plays into our topic today. So Spring was nice enough to put together a little video for us, and the topic is evidence-based dentistry. So let's take a minute to watch that, and then we'll come back and talk.
Hi, my name is Spring Hatfield. I'm a registered dental hygienist, and today I wanted to tell you about evidence-based dentistry. So for those of you who may not be familiar with evidence-based dentistry, it was introduced in the 90s by Gordon Guyatt, and the model is made up based off of evidence-based medicine. So imagine you have a Venn diagram with 3 circles connecting, and the first circle you have patient's needs, wants, and circumstances. In the second circle, you're going to have clinical experience. And in the third circle, it's going to be best scientific evidence. Best current scientific evidence. Let me be clear. Current. And the idea is that you use scientific evidence in your decision making whenever you're treating your patients. The first 2 things that I mentioned before was the patient's needs, wants, and circumstances, which can be very subjective, as well as clinical experience that's in the second circle. That's very subjective as well. So you have to consider your patient's needs, wants, and circumstances, and sometimes we rely on our clinical experience to help us make these decisions. But ultimately, the big part is the current scientific evidence that we need to rely on. It's a great resource that we can always turn to, and we have something to support our decision making. If you're not familiar with how to find science that's relevant, there's a ton of different databases, Medline, PubMed. There's several others that you can also look at, but those 2 are pretty user-friendly and easy to use. Now, when you're looking for this scientific evidence, you don't want to just take some random study that just says, oh, this is what happened. What you really want to look for is systematic reviews with multiple well-designed randomized controlled trials. That's the gold standard because it basically takes a ton of research that's already been peer-reviewed multiple times and it puts it all together and determines what is actually relevant. And that is where we want to get our information from. There's a lot of science out there that's flawed and has a lot of shortcomings, so we need to be aware of that. If you run across a study that you can't understand completely, I would certainly ask someone to help me interpret it because some of them can be very complex. But as a general rule, if you use the gold standard of the randomized controlled studies, the systematic review of the randomized controlled studies, you're going to find that they're much easier to understand and the conclusions are pretty clear. So Anyway, I hope that you will use those resources to help in your decision making when you are talking to your patients about what their needs and wants and circumstances are. And if you don't have a lot of clinical experience, please look to someone to mentor you, ask questions, reach out. I've never ever reached out to someone in the dental field with a question valid for a patient that I have not gotten a response, and they've been gracious with their time and information. So please take the time to reach out to your fellow hygienist, dentist, endodontist, whoever you need to talk to make sure that you're giving your patients the best care possible.
How's that for a dramatic pause?
I love it.
All right, Spring. So in that little short clip, you talked about something very important, and that is using the gold standard when we're deciding what we're going to do for our patients. So throughout my 20 years, I'm sure you have experienced this before. You've got to lunch and learn. Someone comes into the office with this awesome new thing, and they want you to switch your protocol to this new product or tool or whatever it is they want you to implement. And up is this amazing graphic. It's really pretty to look at. And when they're like, does anybody have any questions? Were you the one also in the back of the room that's like, how many people were in the study?
Yes.
And was it double blinded? Was it peer reviewed? Like, did you go back to college days where you're thinking like, oh, I really want to pick this apart?
Yes,
You
absolutely.
were that
every
girl.
time. And yes. And of course my coworkers are like, stop asking questions.
Yeah, they're like, just feed her another sandwich. Be quiet. We want to get out of here.
Yeah, exactly. Exactly.
But
we're just here for the food.
It's so important. And I know people are like, oh God, I don't have the time or energy for this, but you have human beings in your chair. You are a caregiver. And I'm sorry, this may ruffle some feathers. It doesn't matter who you work for. You as a human caregiver to another human who's a patient, I feel like it's our responsibility to take the time to really, and we don't want to use the word research. We've talked about this before.
No.
Unless you're actually doing a study in a college or you're being sponsored to do real hands-on research, you need to study up on things before you decide to implement them in your practice. So we should, people might be thinking, what are they rambling about? Like what exactly are you talking about with this evidence-based practicing? So why don't we give them some examples? Do you have a good example of something?
Well, we could talk about the Mercury Fillings that there are some practices that are recommending to remove them. The science just doesn't say that it's necessary to remove them. I know that it's not used often anymore. We use composites much more regularly than we do amalgams because composites great. I mean, it's a great option. So, but do we need to go get them removed is the question. And the answer, according to the evidence, is no, we don't. It opens a whole host of other problems that could occur to the tooth itself, but not just that, you're being exposed to more mercury by removing the amalgam than you would by just leaving it there.
Yeah, so, you're talking about drill and heat, you know, and like you said, besides just the possible collateral damage from physically removing something that's already in your tooth, you know, whatever restorative situation it is going to get bigger and more expensive to replace that. But also just even for the caregiver exposure potential when taking that metal filling out.
Yes. So I have amalgam fillings in my teeth. They've been there since I was 6 years old and they're still there. So I have no intentions of removing them. Have anecdotally, which I hate anecdotes, but you know, I have no health issues. So take that for what it's worth.
Right. And we will put a disclaimer, like this is not Burst Oral Care's official opinion. These are two hygienists with 40 years plus combined experience. And also I would agree with you in that, would I put a metal filling in my mouth now? No, really no need for it. There's been so many advances in composites and even chair side implemented restorative materials. Like you could use a CEREC machine and do a little mini inlay or something like that, as opposed to what we had in the past. So I wouldn't put a metal filling in my own mouth now, but I wouldn't take out the ones that I have, just because I know. Now, granted, this is, I have the clinical expertise to look at my x-ray. I'm like, pulp chamber's high, that nerve's right there. I don't want to take that out because of all the other things that could possibly happen. I don't want a root canal ever. So I'm just going to err on the side of caution. So if you guys are out there watching this, this does ruffle feathers, because there are providers that are like, metal does not need to be in your mouth. You're getting poisoned by it. And I'm not saying you as a human are wrong. However, I think we do really need to look at all the evidence that's out there, current evidence that's out there, and the combined evidence that's out there, the science behind it. So it's worth having that conversation.
Absolutely. Absolutely. Because it gets costly too, to remove and replace all those fillings and all that kind of stuff. That has to be considered for the patient, as well. So.
Right. And I do worry that a lot of times providers are encouraging treatment because it's going to bring in a profit.
I don't like that.
That's a whole other issue.
Yes, it is.
But next topic that I'd like to talk about. So how about the old root canals are bad? That's a dead, rotting tooth now that can cause systemic effects. So instead of doing root canals, we're going to take teeth out and we're going to replace them with implants. In your experience, what does evidence say?
Okay, so the whole idea and premise of taking out these root canal teeth is based on Weston Price's work back in the 1920s. So we're talking about 100 years ago of science. And the problem with his science, and let me just say this, because I know everybody's going to get angry that I said something bad about Dr. Weston Price, but he did some great stuff with, diet and jaw growth and stuff like that. But his studies, really it's only one study that he did on root canals, it's not even ever been able to be duplicated, which is a huge part of the scientific method. If you can't duplicate the results are as good as garbage. So even the Jada took, in 1951, I believe it was, an entire issue and dedicated it to try to duplicate his research, and they weren't able to do it. It's not that people haven't tried, it's just they can't come up with the same results that he came up with. And science has changed since then. We have a lot more, better techniques and methods and things like that he probably didn't have back then. So I'm not saying that he fabricated his results. His results may be what he really got, but he was working in a non-sterile environment and things like that have to be considered as, today's standards would be not, it wouldn't be okay to do those kind of.
Right. And, I like to point out too, I love implant dentistry. I think it's amazing. But I do go back to the old school thought that having something as much natural elements in your body that were given to you instead of something that's not human, even though the technology is fantastic. I just, again, it's the collateral damage to taking out a tooth. I think there are stages that you should follow and things that you should try first to
absolutely
get on more of a conservative level.
I mean, people aren't lining up to get their arm amputated because they got an infection in their finger it's just.
Yeah, that's a good analogy. I've got a black toe. Well, let's just remove it and put something fake on there.
let's not try to debride it and give you some, try to preserve it in any way. We're just going to take it off. I mean, it just doesn't make any sense. They wouldn't do that in any other aspect of your body. So why would they do it with their teeth?
Right.
Still a part of our body.
And root canals, I mean, statistically, they're proven to be very effective. There are cases where, and people that they're just not going to take to much of what you're doing. Just like you could do, 10 crowns on the same person and 5 of those are going to fail, which throws the stats off incredibly, but they have something else going on that's going to cause their dental work to fail.
Absolutely. Yeah. And full disclosure, I know root canals do fail. I'm not sitting here saying that they don't. So let's be clear on that. But generally they're pretty successful. So, and it's a more conservative route, which I personally like conservative dentistry and preventive dentistry. So that's just my personal opinion there too.
Yeah. I did disclosure again, our personal opinions, we've been doing this a while, but we're not dentists. Everything's case by case.
Absolutely.
Okay. So my head rolled when I saw this headline. Kudos to the guys that published it. But flossing is not proven to benefit your overall health. How do you feel about this one?
This one's wonderful for the media. But the problem with that study is that it was a survey study. So they're asking people, did you floss? How often did you floss? And we know our patients don't lie about that. They're completely honest.
Yeah, they didn't have dental hygienists flossing these people's teeth.
Right, exactly.
No control.
And that's another thing to consider, like technique. What was their technique? Were they just popping a piece of floss between their teeth? What floss were they using? I mean, it's just so many things that could have skewed the results. But again, I'm not pro floss. I am pro interdental cleaning. So I want you to clean between your teeth. I don't care how you do it. So if you hate flossing, don't floss, use something else. But at the same time, please clean between your teeth, because there is evidence that shows cleaning between your teeth does improve overall health as well as dental health. So
right. And so this is kind of on the flip side of things, where you have to use your judgment, because flossing, like you said, it's one of those terms where it's cleaning in between your teeth, but you and I know way different. Some people floss in the chair to demonstrate for me, and I'm like, stop. You hate doing that. It's getting caught up on your overhangs. You have bridges that you can't even identify. You don't even know where they're at. So that in itself is a flaw. The other part of it is that you're talking about someone's medical history, like throughout their life. I mean, this is where you can't possibly study these two things and with a direct correlation. It's just too broad. And so
it really is.
In medicine, we take smaller studies, smaller, really thought out, responsible processes and research, and we can say, okay, if this is true, then this also might be true. So that's one of those things in medicine where sometimes you don't have to have a study to prove something. Now, my point here is, I use the shower thing. No one needs to prove to me that I'm going to get sick or stink less if I take a shower every day. I want to be clean and healthy and not smell bad. So I am going to floss my teeth and I'm going to take a shower every day. No one needs a study, research for me to do that.
Me either. I agree. And see, that's where the clinical expertise part comes in. Like, I have seen this happen.
Right.
So,
I know for a fact my patients that don't floss or clean in between their teeth have infections. And I'm not one to say, a little bit of bleeding, some inflammation. It's an infection in your mouth. Well, that's a whole other topic we could get on for days.
Yeah, because I hate a little bit of bleeding. I don't like that. Either you're bleeding or you're not. Let's not.
It's like, my eye's bleeding just a little bit.
Yeah, don't worry about it. No big deal.
All right, guys. So these are just examples, but we just want to get everybody thinking, like, in your everyday life as a caregiver, are you using evidence-based practicing? And there will be some of you out there that are caregivers that are working for someone else. Let's say, because dental hygiene is what we know. So I'll use this as an example. You're working for a practice. Office protocol is, let's say, everyone gets a fluoride treatment because it might be paid for insurance and they could benefit from it. So I'll leave you all with that. You can leave your comments below as to if you do fluoride treatments on everybody and why. Like, give us the real answer. Why do you do fluoride on everybody? And Spring and I will probably talk about that on another episode, because that's another topic I'm very passionate about.
Yeah, that gets really deep. Yeah, that gets really deep too. Yeah, absolutely.
Listen, Spring, thank you so much for coming on. Evidence-based practicing. Everybody sit back, think about it. As a caregiver, are you doing that? All right. Thanks, Spring. We'll see you next time.
Thank you.
What's your middle name?
I don't have one.
What?
I seriously do not have one.
That's so funny that I would ask you that, like, and have an interesting answer. I was just testing the speed. You don't have a middle name.
Look,
Wow.
no, this is the thing. I was born March 21st, which was the first day of spring. My parents couldn't decide on what to name me. One wanted to name me Mariah. The other one wanted to name me Sherry. Couldn't leave the hospital without a name back then. So they were like, forget it. It's just Spring. And that's it.
Oh, I love that though. And no, you don't, I mean, there's nothing wrong with not having a middle name. I'm not even sure why we have middle names. Maybe because were there only so many surnames and like, it was just a way to like differentiate.
Possibly. I really don't know the history of it, but I can tell you I'm obsessed with middle names because I didn't have one. So I wanted to make sure that like even my animals have middle names now.
That's awesome.